Hello, my name's Dr. Roberts. I'm one of the anaesthetic consultants here at the RVI. We believe that women should be fully informed when deciding what's best for them during their labour and the birth of their child. We've created this short video to give you more information about epidurals for pain relief during labour. There are many options for pain relief during labour. These start with simple things you can use at home, such as paracetamol, a warm bath, TENS machine or hypnobirthing techniques. When you come into hospital, there are more options, such as gas and air or a strong pain-killing injection. Some women choose to have an epidural. This might be because it's in their birth plan, because a doctor has recommended it as the best option for them, or because, despite using other techniques, they're still uncomfortable in labour and want to use more advanced pain relief. An epidural is an extremely effective form of pain relief. It involves having a fine plastic tube placed in your back by one of the anaesthetic doctors. This tube is then attached up to a pump that delivers local anaesthetic to the nerves that carry the pain from your contractions. Your epidural will run throughout your labour and be removed after your baby is delivered. Once it's working properly, should you need to go to theatre to deliver your baby, the epidural can be used, avoiding the need for a spinal or general anaesthetic. If you choose to have an epidural in labour, you will need to be on the delivery suite. This means that if you've been in the Newcastle Birthing Centre, you'll need to be transferred upstairs to the delivery suite before we can put in your epidural. You'll be given an information sheet and then seen by an anaesthetist who's a doctor who specialises in advanced forms of pain relief. If it's very busy, there's sometimes a small delay before the anaesthetist is available. If this happens, your midwife might offer you other forms of pain relief while you wait. The anaesthetist will have a short discussion with you about your general health and any issues that have arisen during your pregnancy or labour. There are occasionally reasons why women cannot have an epidural, but these are rare. They will explain the risks and benefits of an epidural in labour. The majority of epidurals work really well and provide excellent pain relief. One epidural out of every 8 might not quite work as well as we would like, possibly requiring stronger medication to be put into the epidural, or in some cases the epidural may need to be removed and resited. An epidural may cause your blood pressure to drop. This can make you feel faint, but this is usually easily resolved with fluid or medication through a drip. 1 in every 100 women who have an epidural will develop a severe headache afterwards. The epidural works by numbing the nerves in your back. There is a rare chance of causing some damage to one of these nerves. 1 in 1,000 women will be left with a patch of numbness or weakness in one of their legs that will last up to 6 months before getting better. In 1 in 13,000 cases, this patch of numbness or weakness will last longer than 6 months. The risk of any severe nerve damage occurring is less than 1 in 250,000. Epidurals can make your legs feel heavy during the course of your labour. When it is time to deliver your baby, an epidural can sometimes make it more difficult to push effectively, so epidurals can slightly increase the chance of you needing a forceps or ventouse delivery. An epidural does not increase the chance of you needing a caesarean section. Once the decision to proceed with the epidural has been made, you'll have a small plastic tube called a cannula placed into a vein in your hand or arm so that fluids and medications can be given to you if required. Your birthing partner can be in the room with you, or they can wait outside, whichever you would prefer. Your midwife will help you get into the best possible position for the epidural to be sited in. A good position is really important as it opens up the spaces in your back, making it easier to get the epidural in. The best position involves sitting with your legs over the side of the bed with your feet placed onto a chair. You should place your chin onto your chest and drop your shoulders so that you're hunched over your bump. Your back should be curved and pushed out towards the anaesthetist. Your midwife and the anaesthetic assistant will help you to do this. Your back will be sprayed with an antiseptic cleaning solution, and we will place a sterile drape on your back. This helps to keep everything clean. The anaesthetist will then identify the best place to put the epidural by feeling your hips and back with their hands, and then we'll place some local anaesthetic into your skin. This might sting a bit at first, but it will numb the skin for the epidural placement. At this point, it is important to stay as still as you can as the anaesthetist carefully sights the epidural catheter. The anaesthetist will work in between your contractions, so if you have a contraction during this time, please let the anaesthetist know, as they can stop what they're doing until the contraction has passed. You may continue to use gas and air during your contractions while the epidural is being inserted. It usually takes around 20 minutes to sight an epidural catheter, and a further 20 to 30 minutes for it to start working. However, every set of circumstances is different, so do not be alarmed if it takes longer or if a second anaesthetist is required to assist with the procedure. Once the epidural catheter is in place, it will be secured to your back with a dressing and some tape to prevent it from coming loose. Nothing sharp will be left in your back, and you are free to lie back on the bed. The epidural catheter will be connected to a pump that will give you regular doses of medication through the epidural to keep you comfortable. In addition to this, you'll have a top-up button so that you can give yourself extra doses from the epidural pump if needed. Don't worry, this button has strict safety settings which will prevent you from being able to take too much medication. Occasionally, some women notice breakthrough pain, and an anaesthetist will come to review your epidural and ensure that it continues to work. When you come into hospital, your midwife or an anaesthetist will be able to answer any other questions you have about having an epidural. We wish you all the best with the rest of your pregnancy.